Hi guys, so we are here today with Chris, and he's gonna share his story. Take it away.
All right. So hey, anyway, so as Jody said, I'm Chris, and I'm lucky enough to be one of the, however many thousands, hundreds of thousands, millions of people that get to say they have chronic fatigue syndrome. Um, and I wanted to, and starting to figure out a way to open up and share some of my story and some of my issues, and but more importantly, how to try and deal with these issues. So that's kind of what I'm here to hope shed a little bit of light on is my personal story. Luckily, Jody has done an amazing job of showing herself and showing her struggles and worries and endless supplements to consider and try. Um,
Okay, Chris, how long have you had chronic fatigue?
well, chronic fatigue has been part of my life since I believe 17. Yeah, summer of when I was 17 years old. I had a flu-like onset of chronic fatigue. Was bedridden for most of the next 8 months or so, and then slowly rehabilitated to a point where I went to college and rebuilt my life. But I will tell you that it's never been more than maybe 75% of where I was pre 17 years old. Uh,
On a good day, you're saying. On a good day.
yeah, yeah. I mean, like my average up until this last year, I've been able to keep a reasonable life, a reasonable lifestyle. Um, Not to say I didn't have chronic fatigue because I've always had it, and not to say that I haven't had issues with the same. But whether it be brain fog, whether it be just not having any energy or having energy crisis or laying low, but I've been able to monitor and modify my life in a way that it worked. Um, and like I said later in this talk, I can shed the light on what the last years look like and what that how we're trying to repair that, I guess.
Okay, so let's talk a little bit about the doctors you've seen. Have you found any doctors that have been helpful, and if so, what types of doctors were they?
Well, I probably could retire in Costa Rica for what I've spent with doctors, even at this age, at 40. But I've been to the best. I started my journey with Dr. Paul Cheney. Uh,
Oh, okay.
he is quite a
Famous.
character, quite a character.
Yeah.
I saw him when he had his practice in Charlotte, North Carolina. I actually moved to Charlotte from going and living in Kansas City, specifically because I wanted to be closer to a doctor that could help me. And it was a great place to land. Charlotte is a wonderful city to live and work, and also with chronic illness, dealing with the temperatures are good, lots of good for us. But anyway, and he then had his own little medical crisis, which I believe he had a heart transplant done, and so he kind of hid for a while, but he referred all his patients to Dr. Lapp. Um, and he equally was good and qualified. He has a clinic called the Hunter Hopkins Center, which is also in Charlotte. Um, and both of them, put me on B12 shots. They tried me on like stimulants, Provigil, all kinds of little weird things, supplements, etc.
Mhm.
But that was all 10 plus years ago, um, that I saw those two specialists. After spending a lot of money with them and a lot of time and getting no real concrete answers, I moved on. And I
Mhm.
moved on to this idea that, I'll just manage it in different ways, which included a couple of visits to Ann Wigmore's Institute, which is in Puerto Rico, which is a raw livings food program. So even garlic and onions are forbidden in their mind because garlic being a medicine in some cultures and thoughts. Um, so we've tried lots of things, but most recently I've kind of gone back to regular traditional medicine to see what that looks like, um, with very mixed reviews until lately.
Okay. Let's see. So in terms of supplements, what has worked for you in terms of supplements, and then we'll get into traditional medications.
I mean, like, DHA, EA, or whatever, all these things. I mean, in the past, I mean, I went crazy with supplements, um, and was taking tons and tons. What I find is there's one big piece of the puzzle, and like B12 shots are great, um, but they're all artificial. They give you a boost of energy that may or may not be realistic. So, even caffeine. I mean, we both like our caffeine. We kind of at times probably live off of it. But that being said, it's not. It's again that artificial stimulant.
Right.
Same with any of these Ritalins or anything like that. I mean, they can give you a boost, but that boost will get you to a place where you don't recognize that you're burying yourself from an energy perspective.
Your adrenal glands, it kind of wears you out, and especially because those of us with electrolyte imbalances, caffeine is terrible for that. It just drains you of all of those minerals. So
Right.
there's that. It's a game, like it's a roller coaster game when you start adding stimulants. So.
Right. So that's that we always have to be careful of. Um, so I mean, like right now, to very much fast forward, the only thing at your encouragement, as well, is the vitamin D, and you know, uh, and this is vitamin D3 at 1,000 units. I don't know if that actually means anything, the three part, but
They say D3 is easier to absorb.
okay. Well, I mean that's been what I've been on. Um, and obviously, the myriad of drugs that, um, we, obviously you've kind of gone through some of the same path with doctors, but, um, the Michigan doctor, you're,
Dr. L?
yeah, that one, Dr. Lerner, and Dr. Montoya's protocol, with regards to antivirals was something that caught my eye over a year ago. And, I've been watching and reading and looking at blogs and certainly came across your piece of that puzzle. But, I believe in this idea of suppressing anything and everything that we can from a viral level. So in my case, I do test positive for HHV6 V6. Um, it's a very difficult, without short of a biopsy, to tell you definitively. And even if you do a biopsy, it may or may not be definitive. So, those are pretty bad odds for a doctor in order to successfully diagnose you as active. But HHV6, which is also like roseola, which I did have at less than a year old and was hospitalized at that time with it, stayed active for some time, I guess then, and then stayed in my body thereafter. But it is believed at this point that it is active. They believe that it's active also because my Epstein-Barr virus, which is chronic and appears to be active, they tend to play off each other. The other piece of my puzzle is that I am also testing positive for hepatitis A, which I've been testing positive for over a year now. I have not been able to build up any of the IgG, I guess it is, right? Um, the part that fights it, because you have IgM, which is the active, right? And then then IgG being the thing that's fighting it. So my body is still not decided to fight it. Typically, within weeks of getting a hepatitis A virus, you should be able to kick it. So anyway, um, so from that perspective, I was able to ask um, the specialist that I'm seeing in New York to get me onto an antiviral program, which includes.
Did you want to share that doctor's name?
Oh yeah, absolutely. But my brain's not working as good as it should. So
Dr. Levine, right?
Yeah, Dr. Levine.
Levine.
I was going to go to Michigan after seeing your thoughts originally on him, but actually through my attorney, who's dealing with some long-term insurance issues, had encouraged me to see Dr. Levine, which is in New York City. A really wonderful lady. She really isn't much of a believer in a cure for chronic fatigue, but she certainly is a believer that we can get you doing better and more active in your life. And so, with that said, right, she did give me antivirals. We've got, Valcyte, which my insurance company loves to pay for, because that's a $4,000 a month drug. So I'm on that for 450 milligrams twice a day, morning and night. I did do what they call loading dose, which is doubling that dose for the first week that I was on it, which is actually different than the protocol that Dr. Montoya and Dr. Lerner do. But I think it's a good thing. It certainly made me feel.
Well, Dr. Lerner does a lot for. Oh, you're talking about Valcyte, right?
Yeah, Valtrex, Valcyte, a little different drug. Now, similar to the Valtrex, I'm on Famvir, and Famvir is the same class of drug as Valtrex, and that good one. I am on 4 of these wonderful things, which I believe you get 4 pills a day as a Valtrex when you take
For
it.
Valtrex, I had 1 gram 4 times a day.
Right. So
that's expensive too.
Right. So that's
expensive drugs.
Hold on one second.
Does he have to shave?
Well,
He said you shaved him yesterday.
Yeah, maybe you can do it. Anyway, so this one's 500 milligrams at 4 of them a day, so 2,000 milligrams of that one. And that's the extent of the drugs that I'm on for that. One of the issues is because of the hepatitis A that my liver is the AST and the ALT numbers have been high for the last year. And so the doctor that I saw before Dr. Levine was unwilling to put me on any of these antiviral drugs, although I gave him the primer from Dr. Lerner, and he was agreeable to the idea. It's just because of the liver levels he wasn't comfortable.
Right. And I have a feeling Dr. Lerner probably wouldn't put you on it either.
Yeah.
But Dr. Levine has you on it, but she's probably monitoring them.
Right. I get to go to the vampire twice a month. So that they're keeping an eye on it very closely. The other piece of the puzzle for me is I've only got one kidney that's working. So they're have to be very careful with that as well, since everything we excrete is through one of the two, kidney and liver. So.
And they say a lot of people with chronic fatigue have detoxing issues, so it's got to be extra hard for you.
Right. Well,
kidney and no liver.
Right. My infectious disease doctor, previous to this, wouldn't even let me take Tylenol. So we're but I mean, you got to weigh the pros and cons. And although it is Dr. Levine's belief, I think, that I should probably be on these for about a year to year and a half.
Mm-hmm.
I know that some doctors are only doing it for 6 months, but especially with someone that's had this, for 20 plus years, it's a very different fight than somebody that has had it for the last year or two.
Mm-hmm.
And the success rate, as I think we both know, the success rate of, we'll call it a cure, but let's say a cure for somebody that's had this for a year or two is maybe attainable, but somebody that's had it for 20 years, maybe you can knock some of these viruses back and put them back into dormancy, but that's about it.
Yeah, it's like damage control at this point.
Right.
Like